Hispanic Americans. Hispanic Americans are one of the largest minority populations in the U.S. It is important to understand the various terms that are used to describe this population. There is no universal agreement about the terms used. The term Hispano, Hispana, or Hispanic is a Spanish word that means belonging to or related to Spain. The term was first used in official American documents in 1978 to create a separate ethnic group of Spanish origin. The U.S. government adopted Hispanic as a universal term to describe Spanish-speaking groups in the United States. In the US, it refers to those who were born in or had ancestors from Mexico, Puerto Rico, Cuba, Central America, South America, Spain, and other Spanish-speaking countries. Latino, Latina refers to someone who is native of or descendants from a Latin American country, including Brazil. Latino and Latina are used often in California and other Western states, while Hispanics is used more often on the East Coast, Texas, New Mexico, and the South. Latinx is a gender-neutral term to refer to a Latino, Latina person. In general, Hispanics refer to the language, and Latino, Latina refers more to the culture. Chicano, Chicana is a chosen identity of some Mexican Americans. The term was used widely during the Chicano movement in the 1960s. It expresses a shared cultural, ethnic, and community identity. Hispanic Americans differ by national origin, historical and political relationship with the U.S., immigration status, fluency in English and Spanish, levels of acculturation and assimilation, socioeconomic status, and health status and utilization of health services. Demographic data from the 2020 census. It should be noted that the U.S. is the only country that categorizes Hispanic as the only ethnic group. All other groups in the U.S. are called races. Thus, in the U.S., each race can also have Hispanic origin. After white, non-Hispanics, Hispanic Americans is the second largest group in the U.S. They account for 19.1% of the U.S. population, regardless of race. This does not take into account Puerto Ricans living on the island or undocumented immigrants. About 67% of Hispanics are born in the U.S. One, according to the 2020 census, the largest groups are from Mexico, Central America, Puerto Rico, South America, Cuba, and the Dominican Republic. On average, there are 2.3 children in the family. 23% are female-headed households. 73.1% are high school graduates. 20% have a BS degree or higher. 18% experience poverty and live below the poverty line. States with the highest Hispanic populations are California, Texas, Florida, New York, Illinois, Arizona, New Jersey, Colorado, North Carolina, and Georgia. Some sources also list Pennsylvania as 10th or tied with Georgia. The states with the highest percentage of Hispanic populations are New Mexico, California, Texas, Arizona, Nevada, Florida, Colorado, New Jersey, New York, and Illinois. Health issues. 51.5% have private insurance. 37.9% have Medicaid or public insurance. 16.8% are uninsured, and Hispanics have the highest rate of uninsured in the country. Life expectancy at birth is 80 years of age. Women, 82.8 years of age, and men, 77 years of age. Health issues of concern include access to care, large number of uninsured, language barriers, health literacy, heart disease, cancer, occupational injuries, example farm and factory work, stroke, diabetes, asthma, COPD, HIV/AIDS, and obesity. Hispanic American foodways. Hispanic Americans gather frequently for family and community events where food, music, dance, and other artistic expressions are always present. Traditionally, diets were influenced primarily by the indigenous people, Spanish settlers, other Europeans, geography, and available natural resources. While Mexican cuisine is the most common Hispanic food in the US, it is not representative of the cuisine of those living in Mexico or other Hispanic groups in the US. Mexican, Cuban, Puerto Rican, and other Hispanic cuisine vary greatly from each other, and they all take on new forms in the US. Changes in eating patterns in the US are due largely to eagerness to be Americanized, advertising, availability of traditional foods, cost of traditional foods, perceived health benefits, convenience, and participation in government assistance programs. However, there have been healthy changes in the diet that include moderate increase in the consumption of milk, vegetables, and fruits, and large decrease in the consumption of lard and dairy cream. Less healthy changes in the diet include a large increase in the use of fat in the form of margarine, butter, vegetable oil, mayonnaise, salad dressing, sour cream, and peanut butter, and a large increase in sugar consumption in the form of sugar-sweetened breakfast cereals, desserts, and powdered drinks, and a lower intake of fresh fruits and vegetables. Mexican foodways. The cuisine of Mexico is very diverse, and many regions have retained their native dishes. Regional diets differ due to geographical location, availability of local fruits, vegetables, and meats. Most have a unique blend of native and European foods prepared with indigenous, mostly Aztec, and Spanish cooking techniques. The majority of poor Mexicans have little variety in their diet, and the foundation of the diet is rice and beans, tortillas, and corn, bean, and squash, also known as the Three Sisters. Hot peppers are used liberally in meals. The nutritional strengths of traditional Mexican diets include food is high in complex carbohydrates and fiber. Think corn tortillas, beans, fruits, and vegetables. Food is rich in vitamins A and C and beta carotene. The bioavailability of calcium and niacin is enhanced by the use of lime to prepare maize or corn, and small portions of meat are consumed. There is consumption of high quality protein, largely meats, beans, cheese, and eggs. Cubans, Puerto Ricans, and other Caribbean islanders foodways. Cubans and Puerto Ricans have very similar food habits. Although each island has its special dishes, the basic food ingredients are the same throughout the Latin American region. The cuisine is a blend of West African, Spanish, Chinese, and indigenous First People food and cooking techniques. The local spices set the dishes off from region to region. Fresh fruits, vegetables, spices, and peppers are abundant throughout the islands. Fish and seafood are also abundant. Small game is scarce. And the Spanish brought cattle, goats, hogs, and sheep to the islands, and they also introduced rice and sugarcane. Beans and peas are consumed heavily throughout the Caribbean. In Cuba, black beans are preferred, while Puerto Ricans prefer red beans and Dominicans prefer pinto beans. Rice and beans are almost always served at lunch and dinner. Caribbean meals have a heavy emphasis on starchy root vegetables such as cassava, yuca, sweet potatoes, batatas, yams, boniatos, and plantains. Leafy vegetables are heavily consumed as side dishes or in stews. Breads are heavily consumed, and Cuban sandwiches are well known throughout the US. The tortillas that are native to Mexico are really consumed in the islands. Milk is usually consumed as evaporated milk or condensed milk, and fresh milk is usually reserved for young children. Cheese is heavily consumed. Contemporary Hispanic American foodways. Like many groups, Hispanic Americans continue to eat traditional foods, even if infrequently, to stay connected to their tradition, culture, and country of origin. The contemporary diet of Hispanic Americans is heavily influenced by the dietary practice of their adopted community, length of time in the US, economics, working long hours, and a lot of times in most families, both partners in the labor force. Like other Americans, the contemporary eating habits of Hispanics are influenced also by income, time pressures, lifestyle, and marketing, leading to shifts towards easily prepared, takeout, and processed foods. Do not make assumptions or take a one size fits all approach when working with Hispanic Americans. In Hispanic American families where income is not an issue, 3 meals and 2 snacks are typical. Coffee, espresso, and cafe con leche are consumed daily, and a weakened version of cafe con leche is often served to children. Most still retain core elements of a traditional Hispanic diet, including a reliance on rice and beans, fresh fruits, and vegetables in the diet. Some still take a siesta or short nap after the midday meal. And taking a siesta is a common tradition in hot countries. Special occasions. Most Hispanic American holidays have Catholic origins. The most popular international holidays are Easter, Christmas Eve, Christmas Day, New Year's Day, and Three Kings Day, which is January the 6th. Mexicans celebrate Cinco de Mayo and El Días de los Muertos, or the Day of the Dead. In addition, each country celebrates its own Independence Day and other national holidays. La quinceañera is a celebration of a girl's 15th birthday and is considered a rite of passage and initiation into womanhood. It is rooted in the custom of the Toltec, Aztec, Mayan, Quechua, and other indigenous civilizations. And it is celebrated in most Hispanic communities. Thank you for watching.